Well, touching on an economic issue, you do point out that you suggest that part of the big rush to do online therapy are economic pressures. One of the things maybe driving this.
Yes,
This rush.
absolutely. And it was something that was talked about time and time again by the people I interviewed. It allows someone to work with a very, very broad patient base. You're unlimited in the people that you can work with. It may allow some people who work exclusively online not to have any overheads for a consulting room.
Yes.
At the moment, there's a saturation of practitioners all over America and certainly the UK, where I trained. And I think that if you can work online, that you can have a much larger practice.
Yes. Okay.
That's what I call the elephant in the room.
Yeah, the elephant. Yeah, that
we can't talk about, but that is very much there.
That's interesting because in the psychoanalytic relationship with one's patient, the issue of fees is something that often comes up and has to be talked about, and can be a difficult issue. And so it's interesting that pulling out into the larger arena of looking at the therapists and their lives, that there is this elephant in the room.
Yeah, yeah. And I think that it extends to trainings as well, because very problematically, 3 or 4 psychoanalytic institutes in the United States have decided that they are going to offer what they call full psychoanalytic training online to Chinese candidates. And that means that those candidates are getting full psychoanalysis, training psychoanalysis, all online. And I think that raises tremendous questions as to what's being offered. We all know that all institutes across the world are suffering from lack of applicants, candidates. And again, this is a way of extending the pool outwards without actually addressing the fact that if someone has their entire training analysis online, what does it mean when they start to work in the room with someone?
And first China, but not far behind, will be the rest of the world, right?
Well, interestingly enough, when I spoke with someone about this recently who was in a part of America that didn't have an institute, she said, oh gosh, maybe I can work with, the institute in Chicago because they're offering this. So you're quite right.
Yeah, yeah.